Good afternoon, everyone. Thanks for joining us on the news briefing this afternoon. Let's go ahead and get started. We have with us today Christy Mishi. She's the Assistant Director of Public Health. She's filling in for Dr. Moreno today. And Christy, good afternoon. Can you give us an update on some good news or COVID information and then take questions?
Sure. Thank you for having me here today. I just wanted to start out by expressing my gratitude to the public health staff and all the volunteers who have worked with our community partners to respond to COVID. Certainly, this has been a challenging last couple of years. And as we close out 2021, I just wanted to take some time and recognize the really outstanding efforts our teams have made in trying to vaccinate our community and our community coming together to participate in the vaccination clinics. Our Public Health Bureau reached a milestone this week. We celebrated our 200th vaccination clinic in 2021. That averages out to about 4 vaccination clinics a week, which is really outstanding. So I just wanted to take a moment to thank everybody from the folks who are moving tables and chairs all across the county and setting them up, to the folks who are registering people to get appointments for clinics, and down to the folks who are also vaccinating. It's just, I want to take just a brief minute to thank everybody for their service and look forward to continuing those efforts in 2022. With respect to COVID-19, I think that our numbers are up on our website, but just to highlight, we're at about 3.6% test positivity and a case rate of 9.3 per 100,000. Our case rate seems to be holding level recently, but our test positivity is increasing, and that's concerning. Certainly we're hoping that folks will continue to take measures to help prevent the spread of COVID, no matter what variant it is. And that's really, taking the opportunity to get vaccinated. If you are fully vaccinated, please, and you're eligible, please consider getting a booster. With the data coming out.
Sorry, I'm trying to find the person who's that errant audio.
Okay.
There you go.
We do know that the data coming out, preliminary data about the Omicron variant, seems to indicate that 2 doses, a full series for COVID vaccination, may not be enough. So we're really encouraging folks to consider getting a booster. They're widely available in the community. You can go to a pharmacy, you can go to your doctor's office, you can go to a community clinic, but please do consider getting boosted at this time. We don't know a lot about Omicron now, but the data coming out do indicate that we probably need that extra protection from the booster dose. Also, some of the other things we can do to help prevent transmission is wear a face covering. My mask protects you and your mask protects me. So let's all come together as a community and try to protect each other when we're out in public settings. We are also recommending that folks get tested before and after traveling and gathering. Ideally, that test happens a day before you travel or gather, and then again 3 to 5 days afterwards. We are recommending people get either the antigen test, the rapid antigen test, or the PCR test. Whatever is available to you is the best test for you right now. And then, certainly stay home if you're sick. While we haven't detected the Omicron variant yet in Monterey County through our whole genome sequencing surveillance, it's likely here and spreading. So we need to make sure, we know that the Omicron variant appears to be more transmissible than the Delta variant. So it's really important that people stay home when they're sick so that we don't inadvertently transmit it to other people who may be vulnerable to severe illness. And I think I'll stop and take questions from here.
Thanks very much. And really, thanks for kind of giving an overview of where we are right now. It's really very helpful. I have 2 questions that have already been submitted. And then there is a question in chat right now, but that is for one of our other speakers. So we're going to ignore that one for the moment, but not forever. So here's a question for you. Are you surprised that Monterey County still does not have a confirmed Omicron case?
No, I'm really not, because I think it's here. It's just a matter that our surveillance systems have not detected it yet. We only sequence about 60 specimens a week. Based on what we're getting in from the community providers, that's certainly not enough specimens to say we have a robust surveillance system for it. So I'm not surprised we haven't detected it, but we are working under the assumption that it is here and it is spreading.
And that's a good follow-up to this next question. And all these questions are about Omicron today. Is Monterey County expecting an Omicron case soon, such as Santa Cruz County right next door now has a confirmed case?
Right. So we have Omicron all around us, from to our neighbors to the south and our neighbors to the north. And yes, like as I mentioned, even though we haven't detected it, we assume that it is here and spreading.
Are there any other questions for Christy before we let her go for the day? Not seeing any. Thanks very much, Christy, for joining us on the briefing today, and happy holidays.
Thank you. You too.
All right, we're going to go on to our next topic, which is the Emergency Broadband Benefit Program. We've talked about this before on the briefing, and you've probably seen a lot about it on the national news. This is the program that provides a subsidy for internet costs for people who are struggling through the pandemic. A lot of residents who probably could be taking advantage of this aren't, and there are some changes in the program that would make it really advantageous for them to sign up now. So we're very pleased to have Eric Chatham, who is our Director of Information Technology at Monterey County, to talk more about the program and about efforts to get people signed up. Hi, Eric.
Hi, Maya. Thank you very much, and apologize for having to join via telephone, but I'm having internet service providers today, so I was getting bounced in and out of the meeting. So thank you, everybody, for joining us this afternoon. Maya, just want to confirm, can you hear me okay?
I can.
Okay, thank you. So I wanted to provide an update on the Emergency Broadband Benefit Program that's referred to as EBB. It helps lower the cost of high-speed internet to qualifying households. It provides a $50 discount for internet services and $75 discount on qualifying tribal lands. And there's currently in Monterey County over 8,000 Monterey County residents taking up and signed up for this service. I'm going to go through a list of qualifications, so bear with me. There's about 10 here. These all exist on our county website, so you can go refer to them if you don't catch them while I'm discussing them. But these are the qualifiers for being able to be part of the Emergency Broadband Program. If you qualify for Lifeline phone benefits, if you receive Medi-Cal, if you receive EBT, which is CalFresh or CalWorks benefits, if you lost your job or were furloughed and your income is $99,000 as an individual or $198,000 that filing jointly, if you receive lunch through free or reduced price lunch programs, if you received a Pell Grant this year, if you qualify for any existing internet provider's low income or COVID-19 broadband benefit, or if you have an income less than $12,880 or $44,660 for a family. All of these can be seen on our county website as well. So you can look at, and if you meet any of those qualifications, you can sign up for this program. And we also have a link for signing up this program on our county website. So the other news is what is changing. We just received information from the government that they are going to be changing the EBB program. So the EBB will transition to a new long-term affordable connectivity program, ACP. Those that are signed up to EBB will receive the benefits until March of 2022. And then it will be transitioned to this new program. The new program that begins March 1st, the maximum benefit will be decreased from $50 to $30, but it will stay $75 discount for those that are on qualifying tribal lands. So that's the big change. So what we highly recommend that everyone sign up for the program that qualifies so that you can get the higher level coverage, and then also be on there to get the additional coverage or even the lower continued coverage as time goes on. We've really been trying to promote and get the word out. We've talked through the school system as well and working with them and making sure that they announce it, in which they have to to students and families of students. So, and we continue to promote through the county means through MAYA and the different social media platforms and news platforms. So with that, I'm open to taking any questions.
Thanks very much, Eric, for kind of running it down for us. I don't have any questions for you yet, but I have a question. The amount of people who've signed up so far are about 8,100. That seems to be a small percentage based on the population we know has struggled during the pandemic. Any thoughts on why people may be hesitant to sign up?
I don't have any thoughts on why they would be hesitant. Maybe it's access, ability to walk through it. We'd be willing to help anyone that may be struggling with that if they can reach out to us. But all of these are fairly easy to, if you get on the county website, you can click on the links and just follow the information on the links. They're pretty easy to sign up for. So it's just a matter of getting the word out, letting everybody know. If you happen to use it or know someone that could use it, help them, take a look at it, walk through it. They can get access through, if they have data plans on their phone, which most folks do, they can access via their phones to do this, to get the service. We ranked about midway between all the counties in the U.S. I think we were the 26th, if I remember right, county as far as percentage per capita of people using it. So there are probably more qualifying homes within our county, and we just would really like to get the word out and let people know that it exists and to sign up for it.
Thanks very much, Eric. And I don't have any additional questions for you. Thanks very much for filling us in on these changes, and hopefully more people will sign up.
Yep, we will keep an eye on it. Thank you so much, Maya.
Thank you. And then for our last topic today, we're pleased to be joined by Rick Encarnacion. He's the acting bureau chief for our Environmental Health Bureau of the Health Department. California's reinstated indoor mask mandate has brought back some requirements for Monterey County environmental health inspectors to work on. And Rick is going to tell us how those inspectors are working with the businesses that they regulate, such as restaurants. Good afternoon, Rick.
Hi, good afternoon, Maya. Good afternoon, everybody. Yes, the work for environmental health in the county, we're the county's region-wide health inspector. And like what Maya mentioned, we work with the retail food industry, a wide range of businesses, including gas stations, any business that has a health permit. And with respects to the statewide mask mandate, our work has not changed. We've provided information, education, and outreach to assist the businesses to comply. I think the notable difference between, if you can think back when the county had a mask mandate with regards to issuing citations and violations, we still have that option to address the issue as an issue that would require notice, just like the same type of violations we do right now with addressing E. coli, norovirus, salmonella, the same types of controls and the same types of methods for compliance. But it's primarily providing resources to the businesses to comply with this specific mandate. And businesses can comply by having assuming that their customers self-attest by providing signage. We provide signage that the businesses can post on their windows. We can make suggestions on what they can post on their websites if needed, and we can move forward from there. We also address complaints, just like what we do normally. We address complaints not just for masks, but the routine complaints about sanitation and pest control and other things. But with respect to the mask mandate, if there's any concern the public has with the businesses that are health regulated coming to compliance, they can contact our department at 831-755-4505. I think there's a question, Maya, in the chat, whether we've issued citations at this. There have been no citations to be issued. In general, the majority of the retail food businesses that we have worked with and we continue to work with are very much in compliance. And I think the general public understands the importance of the control methods, especially vaccinations, and what our colleague mentioned to promote vaccinations and the booster shots. It's much different from when at the beginning last summer, when there was no vaccinations, and right now with the mask mandate and trying to address the issue at hand, the most current pressing issue, the general public, the businesses, they all understand, how we can try to keep this under control. And there's resources out there to inform the public, signage and resources that we provide. We can even provide consultations. We do consultations every day when we do our inspections. And again, we still have that option to provide enforcement, especially for those that the mandate is pretty clear. You cannot prohibit somebody from wearing a mask. You cannot say that no masks are not required, or you cannot say that masks are not required in your establishment. So I think that's pretty clear. In terms of the health inspectors, if somebody asks the questions to the health inspectors, what is the current mandate, we can provide that information. We provide outreach and education. And if needed, we have that option to provide enforcement.
Thanks very much, Rick. And the question that we're in the chat about, there's two about enforcement, and this might be a great opportunity to clear up confusion about enforcement. There's two kinds of enforcement. There's what you might do for health regulated businesses, and then other enforcement that would be a law enforcement option, correct?
Well, I can't speak for, say, like the sheriff or code enforcement or police in the local cities. The health inspectors, the Environmental Health Bureau, we're the local agency that issues health permits so that businesses follow rules and regulations related to health that are stated in the applicable code. So we do have an option to enforce compliance with respects to the status of the health permit, which is a basic requirement by local code in order for a business to operate. The law enforcement, where there may be penalties, jail time, or whatever, I think that's something that may be directed to local law enforcement on their option. Is also the state mandate is also at the state level enforced by OSHA, Cal OSHA.
This enforcement with this is multi-layered, and I think it's really important for people to know what you do in terms of the health aspect, and then there's another arm of that for other things outside your purview.
Right, that's correct. The health department, the Environmental Health Bureau, we're not all encompassing in terms of enforcement. That's why this is, at least my agency, we're kind of focused in on restaurants, markets, basically the businesses that have a local health permit.
Thank you. And if there are any questions for Rick before we wrap up for the day, go ahead and put them in chat, because we kind of riffed off a little bit of the questions that we had, and we may have answered people's questions. I'm not seeing any come in. Thanks very much, Rick, for joining us and explaining how this is going to work. Hopefully, you've only got a few more weeks to go on this one. And thanks, everyone, for joining us on the briefing this week. This is our last briefing for the year. So happy holidays to you all, and we'll see you next year.